Hi, my name is Kesley Tyson. I am the Director of the Clinical Trials Office and Research Operations here at Morehouse School of Medicine's Clinical Research Center. When I was a child, I remember reading a story that kind of it was a research study, an article in a newsletter or a magazine, and it was kind of negative as far as what the Black community, as far as those statistics went. And something in me didn't believe those. And so I wanted to know how they came up with this information. And so I've very much been focused on processes and how information is gathered and seeing what ethical issues arise. And so that's primarily been my focus. There are multiple ways that you can participate in studies. Some of them are one-time visit. Some are 100% remote. You don't even have to come into campus. You may be required sometimes to have a lab draw. It may be simply tracking the medication that you're taking in a journal. And so it varies on the different types of studies that you can participate in and what that participation looks like. I understand why people may be hesitant to participate in research. It does have definitely has a dark past, especially when dealing with our community, with people that look like me. And so my background is primarily regulatory and compliance. And one of those things I wanted to make sure that I had that knowledge so that when I'm speaking to people, I can make decisions through an ethical framework. And so be it at Morehouse School of Medicine, and we have faculty and staff researchers that look like us, it is important for us to be out in the community. It's not enough for it just to be us, but we need the community to participate. And so we have people that look like you that have the same goals as you. We want everyone healthy. Majority of medications that are on the market now do not really consider, I would say almost 50% of the population, they are the majority of people that participate in clinical trials do not look like us. And so it's important for us to participate so that our information, our DNA, our data can be included in those analyses. And so we can know how it affects us, and not just us, but other people of color as well. But when we're looking at it, we're thinking about our next generation, and we want to help the ones today that can benefit from the research advances from research, but we specifically want to help our children and our grandchildren as well. And so it's important for us to take that initiative, take the time out during your day, come stop by to see us, get a lab draw, do a couple of surveys, and just contribute to advancing research in our communities.
I'm Elizabeth Ojemakande. I am the project director for the All of Us research program here at Morehouse School of Medicine. I'm a medical doctor. I trained as a pediatrician. The reason I got into pediatrics was because I was really interested in children's health and in saving children's lives and making sure they had better access to quality health care. I think along the line, though, I realized that I wasn't feeling as fulfilled with that because it was just more about treating people as their diseases came up. And so I started to look into public health and into how I could make communities be better as a whole. And I just figured out along the line that ensuring the health of children meant that we had to do more in our own lives and in our communities to be able to ensure that and the health of future generations. So I chose to also go into public health. And along with public health, I developed an interest in medical research and clinical research, and that's what brought me to the All of Us research program. All the medical breakthroughs we have now and the things that we use and some of the things we just take for granted came out of research. So there are things that people have been doing for a long time. Even the glasses that I'm wearing came out of research. People were able to look at the different issues people have with their eyes, eye conditions, and figure out, okay, these are the kind of glasses that will work for somebody who's short-sighted, or somebody who needs just a little bit of help to read. So it all came out of research. There is a field of research right now that's called precision medicine, and it's focused more on tailoring things or making it to be more individualized to, my problems, your problems, something that is specific to you. An example is something, we hear a lot about, diabetes, or some people just know it as high blood sugar. One diabetes drug may not work the same way for two different people. And a lot of that is due to our genetics. It's due to the things we get exposed to in the food that we eat, in our environments. But if you just start taking, medications, or if medications are prescribed for you, it might not really do what it needs to do to get you better. So this area of precision medicine is looking at gathering enough information about the different kinds of things that we all experience to be able to say, hey, this drug will work really well for you because you are a Black person, a Black woman living in this particular environment, and you eat only vegetables, or you eat a lot of meat, and maybe you need to cut down on it because that'll work better with this drug. So there's a lot of things that go into it, but the simplest way to put it is that it's something that's going to be personalized for you. It's something that's going to be made individual as much as possible. There have been a lot of dark moments in research, and some that specifically affected our community, the Black and African American community. It's unfortunate because it happened, but then also we got to know about it, and we got to find out ways to make sure that it doesn't happen again. Now, a lot of that has made people to be really afraid of research, or feel like if I participate, something bad is going to happen to me, it's going to happen to my children, it's going to happen to my generations, or I won't get any benefit from it because the government is going to take it all. To that, I would say that if an evil happened, or if something bad happened, the solution is not for us to run away from it, it's for us to confront it and to be able to make the environment so that it won't happen again. It's for us to be able to put people in key places, people who look like us, people who care about us, in key places to make sure that we can check this and it's not going to happen again. So for me, part of the reason I'm participating in research is so that I can be one of those people who is representing our community, who is being able to say, hey, when you're making these research studies, when you're, doing the day-to-day of these research studies, are you paying attention to this? Are you, is something you're doing possibly taking advantage of our community? And being that voice to be able to say that, no, we need to change this, or we need to hear from the community to say, is this something that they really want? Is this something that's going to help them? And also being able to pass across the information to the community, our community, in a way that we will understand, in a way that we'll see that this is beneficial to us. So to the person who's kind of reluctant to participate in research, I will say, please don't, because we need you. Things are not going to get better unless we put our feet in the water, unless sometimes we have to jump in, feet first, and be ready to actually be the ones that are going to make that change. And I think we owe it to ourselves. The fact that we've gone through so much, it just means that we owe it to ourselves to be there and to make sure that it doesn't happen again and that things start to benefit us. Part of the study and part of the research, you are asked a couple of questions to provide information about yourself. Your information will be stored in a database. However, there's ways that we protect that information to make sure that not everybody has access to it. Also, if you choose to, you could share your electronic health records, because that gives us a better idea about your medical history, the kind of conditions you may have, and so it can help researchers to decide, better ways to make things tailored to those health conditions. But again, there are a lot of safeguards on the information. People can't just walk in and get the information. I can't even get access to all the information because there are different things that are used to protect it. There are also agreements with the U.S. government so that the information can't be, the word is subpoenaed, so in a court of law, they can't pull that up and say that they're going to use it against a person. So those kind of information safeguards are there. So people can't just walk in. There's a lot that they do to make sure that the information is secure and to make sure that we're protecting everybody who chooses to share their information.
My name is Doris Aweka. I'm a research navigator with the All of Us research program at the Morehouse School of Medicine. Besides running the clinic, the day-to-day affairs of the All of Us research program clinic, I also manage a team. Joining the All of Us research program here at the Morehouse School of Medicine actually just checked off all the boxes in everything I've always been interested in learning about and in helping. Are you aware that a Black African American is more likely to die of Alzheimer's over and above other races? Also, a Black and African American child most likely will die before he or she gets to 1 year over and above other races. So my passion for community and health kind of like drove me to going into public health. So in as much as people hear research, precision medicine, and they think it's, it's a whole complicated, process, it's actually extremely easy to participate in the program. All you need is an ID card, a United States, ID card, and, just make sure that you're 18 and above, and that, qualifies you to participate in the study. I would advise anybody, friends, family, to participate in All of Us research program. Why? Because it's a process that helps to treat, prevent, and cure diseases that we know about now and might come later in the future. And it doesn't just help us presently or currently, it also helps our generation to come. So even if we don't find the cure of those diseases today, as it were, our generations to come will have access to the cure of those diseases and treatment of those diseases.
Hello, my name is Marisa Elliott. Clinical research is very important to the Black and African American community because you need to know how that specific drug, that data associated with the drug affects you, affects our community as an individual. It's wonderful when you have other ethnic and ethnic groups and races involved in clinical trials, but that data will, to a point, only be germane to them. Everybody is different, especially between racial and ethnic groups, and you need to see how said drug will affect and work on you as an African American. So the data is very important, and it is extremely important that African Americans participate in these trials because we have seen over time, over the years, that there is a need that we will find ourselves having to take those drugs, but then not having the data to support how it could possibly affect us in the long run. Approach your doctor's visit as you were prepping for an interview for the job you wanted. How would you prep yourself? What are the notes you would take to get ready for this visit? Take the same approach when you go to the doctor. Sit and think about the things that you've been experiencing from one wellness visit to the next, or if you found yourself not feeling well and just needed to go in for a visit, write down everything that you've been experiencing, because undoubtedly what happens when you get into that office, you're going to forget. You're going to forget. You may be a little nervous. You want to make sure that you are being mindful of your physician's time, but that you have your time. And when they ask you what brings you in today, even if you have to take out that notebook, that card, be able to rattle off everything that you have been experiencing, because then it makes your physician think. While you're sitting with your physician and you're having these conversations, let that be the time when you ask, are there any clinical trials that are being run right now that could assist me, that I might be interested in? I guarantee you that your physician will go back to their office and pull up that documentation to be able to help you with what it is that you're facing.
Hi, my name is Dr. Priscilla Johnson, and you're here at the Morehouse School of Medicine in the Clinical Research Center. My job here is the Associate Director for Clinical Research. I became interested in research because my first entrance into the healthcare field was as a nurse. I worked in the emergency room and ICUs, and I not only wanted to know what to do, I wanted to know why it happened. Therefore, I came into research to see what I could do to help our people. Did you know that until 1996, there was no law that said we had to be included in any kind of research, and they came up with the NIH Revitalization Act. that says underrepresented populations such as pregnant women, children, minorities had to be included in research projects to make sure that there was a clear and equal dispersion of results when they came down to being reviewed. Now, Big Mama used to take medicine, and her feet would be so swollen, and you never could figure out why, because she took her medicine. It's because we'd never been involved in the trials. So one thing I would say to you is, if you're going to shout, we want to be included, then research is where you want to be included, where you make the most difference. Now there's a project here called All of Us, and they're looking at DNA. We need to look so that you can have some kind of control over your life and know what's coming down the pipeline and maybe even change your lifestyle for a healthier lifestyle. Please don't even think about it twice, and notify us here at Morehouse School of Medicine, and join today with us when we look into the All of Us project. All of Us means you too.